Hi everybody, Mary Ferguson-Perret here for Newsdesk, and thanks for joining us this week. I know that you have been hearing our president, Dr. Bob Bell, talk about the development of a new strategy for University Health Network. And one of the cornerstones of that strategy is value for care. And so I want to talk to you a bit about this today to help you to understand that we are really well positioned to work on improving value for care, because it is absolutely embedded in patient-centered care and all of the lean and redesign work that we have been doing that are all so integrated. And so I have for you just a brief overview of Dr. Michael Porter's elaboration of a strategy for healthcare reform toward a value-based system. And this is a publication in the New England Journal of Medicine by Michael Porter, and he's from Harvard, and he talks about the fact that the focus presently in healthcare is on minimizing the cost of each intervention and limiting services rather than maximizing value over the entire care cycle. And he says that to achieve a value-based delivery system, measurement and dissemination of health outcomes must be mandatory for every provider and every medical condition. Outcomes must be measured over the full cycle of care for a medical condition, not separately for each intervention. So the thinking is to look longitudinally and to follow patients over time. And this outcome measurement includes not only survival, but also the degree of health or recovery achieved, the time needed for recovery, the discomfort of care, and the sustainability of recovery. Outcomes must be adjusted for patients' initial conditions to eliminate bias against patients with complex cases. So you can see that we need to begin to think about monitoring how our patients are doing over the longer term. So he goes on to say that secondly, we need to radically re-examine how to organize the delivery of prevention, wellness, and screening, and also routine health maintenance services. And here's a big opportunity for nurse practitioners in our system. The system underinvests in these services, he says, and in particular in primary care providers to deliver, who are presently delivering disparate services with limited staff to excessively broad patient populations. And he sees a need for structures of delivery of specified prevention and wellness service bundles to defined patient populations. And thirdly, we need to reorganize care delivery around medical conditions, in his view. We need to move to integrated practice units, and of course we've been talking a lot about integration at UHN. And he sees this as encompassing all the skills and services required over the full cycle of care for each condition, including common coexisting conditions and complications. And units should include outpatient and inpatient care, testing, education and coaching, rehabilitation with the same actual or virtual organization. Here again is the theme of that continuum of care and how we can see patients before, during, and after their time with us inside of UHN. He says government policies creating artificial obstacles to integrated multidisciplinary care should be modified or eliminated. The fourth point he makes is we need a reimbursement system that aligns everyone's interests around improving value for patients. And that means a reimbursement system that aligns everyone's interests and bundling payments covering the entire cycle of care for a medical condition, including all providers and services. Fifth point, and soon to be sixth one is last, so hang with me. We must expect and require providers to compete for patients based on value in terms of what they give. This would mean then UHN could potentially become very large. Is if we were providing the best value, then we would be the provider that would look after the most patients. This would allow excellent providers to grow and serve more patients while reducing fragmentation and duplication of services. And his sixth point is electronic medical records enable value improvement, but only if they support integrated care and outcome measurement on the continuum of service. Finally, and this is the big one, he believes that consumers must become far more involved in their health and health care, and especially that they would lead their care and service delivery. So please know about this concept of value for care. It's part of our strategy, our new strategy at UHN, and all of us are already working with these concepts and can take them even farther. Thanks. That's it for today. Bye-bye.